Hello again, everyone. Okay, so I spoke a little bit before I said I would open the box, so let's open the box. Let's open the box and see what's inside the box. Gee, I'm shaking, believe it or not. It's a very exciting moment. Okay. So I'll speak a little bit while I'm opening the boxes. So this is something that we call the implant organizer. I had a different name for it, but we decided to simply call it the implant organizer. So it consists, as you can see, of two halves, a right side and a left side. Let's open it. Nicely, heavily constructed, good weight to it. I can rotate it, I guess, for everyone to see. So if you guys notice, we have the tooth labeling system done in the universal way, the way we do in the United States, I guess, from 1 through 32. If you also observe, we also have the European way, okay? So this is very, very conducive to be used by all specialties that perform any implant procedures. Now, what I'd like to mention is that here on this organizer, which is a surgical and prosthetic organizer, we are omitting and leaving out the wisdom teeth because, as we all know, we do not place implants in the wisdom teeth. So the numbers here go from, if you guys want to take a look, I don't know if we can get it on film, we go from 2, 3, 4, 5, 6, up to tooth number 8. So this is handling the upper right or lower right quadrants, which I'll show in a moment. And this side here is handling the other side of the mouth, okay, on the left side. And here we have tooth numbers 9, 10, 11, 12, 13, 14, 15. Again, omitting the wisdom teeth. So now let's say you're working, now this is what I didn't show anyone. This is magnetically attached. And when you rotate it, so now again we're working on the upper right side. If we want to work on the lower right side, well, excuse me, I'm doing it backwards. I confuse the sides because I'm looking at it backwards. Regardless, we have a dedicated right side and a dedicated left side. As you rotate, now we have the tooth numbers representing the lower jaw, okay? So the way this works is this way. When I'm planning a case, let's rotate to the right face here. When I'm planning a case now, I have a bunch of implants sitting in the drawer, and based on site number, I take my vial and I get it ready for surgery. If I'm working only on the right side of the patient, I will only use the right side of the organizer. If I'm doing a guided surgery case and I'm doing a full large case, then I will utilize and place all my implants in the respective sites that they belong to. So as I'm planning my case from the CT scan, I'm essentially positioning all my vials here ready to go for surgery. Now, an advantage of this is that you will never be faced with a dilemma where you open a flap and you realize you don't have the implant in stock. It happens to all of us, it's happened to me, and it still happens to me. But this organizer will assure you that that will not happen again. So now the implants are ready. We go to the surgical theater. Everything has been checked and double checked. So now me placing the implants and being the surgeon in question, everything is ready to go. I do the osteotomies and simply ask my assistant for a tooth number or site number. And if I ask for tooth number 2, she gives me one from here. If I ask for tooth number whatever 14, she gives it to me from here. Now, she opens the vial, gives me the implant. I place the implant in the mouth. Then the assistant is instructed to take the empty vial and place it back into the organizer where it came from. So at the end of the surgery, all your implant vials, empty, are placed back into the organizer. So now this is important for record keeping, and as we all know, record keeping is essential. So at the end of the surgery, when I write my patient file, I simply take the vial, peel the stickers, place them in the chart. Very simple, no magic to it. Now, the restorative phase comes. During the restorative phase, you simply remove the top pieces. They are again magnetic, okay? Very beautifully constructed by Helmut Zeff. So now I have the pieces, and again, if we can get them on camera and show the audience. So tooth number 2, 3, 4, 5, 6, 7 through 8. Okay, so that's the upper right. And then 9, 10, 11, 12, 13, 14, 15. So now as you remove any of your components from the patient's mouth, you can plain and simply put them according to site number, take your impressions, you can use it for other components as well, and then at the end of the procedure of impression taking, or whatever you're doing that particular day, you simply take all the components from here and put them back into the patient's mouth in a very organized, fashion without any confusion existing. Another advantage that we can do with this particular device that works excellent for is when you're doing porcelain veneers. Now, as you guys all know, when we do porcelain veneers, we typically prime the ceramic, we put bonding agents, and then they become slippery, and essentially you can get them confused very easily. So this works terrific for this purpose as well. Your veneers are primed and placed in the respective slots by tooth number, and then you simply bond them on. Okay, so there's a multifactorial use here. Again, the construction is beautiful, very heavily made, and once again, the pieces are magnetic. The other thing that's really nice with the way Helmut Zeff designed the slots, you cannot put the wrong side into the wrong piece. So the way the teeth are designed here, one will only go with one. So in a nutshell, that's pretty much it. Now, one other thing that I just want to mention. Some implant manufacturers, most implants come with a vial. So in this case, I put straight the vials here. If you're doing a guided case, this is also very useful, because in a guided situation, as we all know, you're pretty much committed to placing pretty much what you planned. There's ways around that, but let's not talk about that. So when you're doing a guided case, it's perfectly fine to open the vials and simply put them again here. But if you notice, we've developed recesses that maybe are hard to see here. But the way this works is you could actually take these packages and put them this way. It's really a little bit more tricky to use, but it can be done, okay? So you can improvise a bit this way. It's really not designed to be used this way, but it can on occasion be, it can be done, okay? So I hope you guys enjoyed this brief little demonstration. We always love having you with us, and we hope many of you will benefit from using this product in your careers and in your practices. And once again, on behalf of Helmut Zeff, we'd love to see you at the International Dental Show, or the IDS, in Cologne, Germany, coming up in March. Thank you again.